Because for the house, it's easier to imagine everybody have a concept of what is a kitchen will look like, what is a garage will look like. Even if you make some mistakes and buy a wrong house that's not suitable for you, you can always change to move to a new house or do some renovation to recover your wrong decision. Whereas choosing the best treatment is very difficult. There are lots of difficult technical words and knowledges that doctor talk to you about. And once you have done it, you cannot really exchange or change or reverse. And that's what gets very difficult. So to achieve the best treatment for the patient, I say, know yourself and what you want. One patient might be looking for a preventive medicine, whereas another is looking for just to fix the current problem. Another one maybe want to do every possible treatment that's available in the market, or maybe another one will just want to minimize the treatment and then try to live more naturally. Or are they willing to try new treatment with possible risk? Well, this is also very interesting because 80% of my patients do come from overseas, including United States. But I discovered that the Western people tend to take more risk for the new treatment. They prefer what is the newest out there in the market, whereas the Asians, including Hong Kong, China, Japan, Malaysia, we tend to play safer. So that's why most of my patients who come from Asian countries would like to have a stronger evidence of safety and efficacy. So I found that quite interesting. Number two, to achieve the best treatment is to trust somebody who gives you negative information, not just always give you positive information. For example, the risk of treatment, including the immediate reaction of the treatment and long-term risk. And is it feasible for your lifestyle or belief? And the cost is matched or not. Number three is the ultimate customization with the holistic view. So obviously, we often try to focus on the symptoms that the patient complain, but within that goal, I'm always trying to include the patient's background, including what kind of family member he has, what kind of lifestyle he has. Is he the night person, morning person? He likes to do a lot of exercise or doesn't want to do exercise. He likes to eat a lot of supplement. What is the value and goals he has, or his economic situation, and combining all these matters to choose the best treatment for each patient. Okay, second question. This is often asked as well by both patients and physicians. What is the difference between stem cells, supernatant or conditioned media, and exosomes? I think people often get the terms very, very confused. Before I start that, what is regenerative medicine? Of course, many cells within ourselves die naturally every day, and in order to compensate that, the new cells are being created every day. And stem cells are the material required to make cells in our body. So the regenerative medicine really works to increase the number of high-quality stem cells and improve their regenerative ability. So if you look at this diagram of tree, stem cells is like the trunk of the tree, which can grow branches, leaves, flowers, and fruits. So the first characteristics of stem cell is called pluripotent. It's the differentiation ability to change stem cell to different kind of cells. For example, liver cells, nerve cells, heart cells, what is necessary in our body. Exosome or conditioned media are considered to help the stem cell to differentiate into different cells. Second characteristic of stem cell is called self-replicate function. Imagine if you only have one stem cell in your body, and if you use it for one purpose, you don't have any more stem cell left for the future. That's why the stem cell can replicate themselves, their identical copy, to prepare for the future. The third characteristic is called homing. So the stem cell able to catch signals from the damaged cells and tissues and go there to gather and concentrate to repair the wounds. So again, the characteristics of stem cell self-renewal and has differentiation function to transform into other cells. It's a multipotency and homing ability. And some of the efficacy of mesenchymal stem cell are strong anti-inflammatory because they can suppress pro-inflammatory cytokines such as TNF-alpha, interleukin-6, and increase anti-inflammatory cytokines such as interleukin-10. Another function being immunomodulation. This is especially works very well for somebody who has autoimmune diseases to suppress some of the immune cells or tissue generation, anti-apoptic cells to prevent the cell death and prolong the survival period of the cell, or antifibrotic. This is also a very important function of a stem cell and angiogenesis, which means to create new blood vessels and improve your blood circulation. Antioxidative stress, neuroprotection, and homing to injury sites. So this is just the treatment flow of our adipose tissue-derived stem cell. First, we take a small portion of fat tissue, either from the patient leg or stomach, and then we send it directly to our on-site laboratory CPC to cultivate the cells. And then after 6 weeks, this is the photo of the stem cell. We all prepare to inject to the patient either by IV or local injection. So next, what is the cell supernatant, or in another name, conditioned media? So supernatant is the liquid solution left after the stem cells are cultured. So when stem cells are being cultured in a cultured dish, the stem cell secretes a lot of cytokines, the liquid that includes. But after the stem cell is being cultured, only the cells are being extracted to inject. That's why we are left with a lot of juice. It's just like, I don't know if anybody who made yogurt before, when you make a yogurt, you see a lot of liquid that's accumulated on top of the yogurt, whey, right? So I often describe supernatant as the whey of the yogurt. So it contains the similar ingredients, but it's not quite the same thing. So it does contain growth factors, cytokines, and exosomes, and microRNAs and proteins. And what are the exosomes? So exosomes are the extracellular vesicles, approximately 30 to 150 nanometer, very, very tiny, and secreted by cells, which mediate intracellular communication by bioactive molecules such as miRNAs, mRNA, and proteins, and are involved in immune regulation and tissue repair. So what people are really confused about is exosome is just an empty envelope that help communication between the cells. They're like mail delivering man, as I say. So what is really important is what's inside the exosome that makes the difference. So what is the difference between stem cells and exosome? So stem cells, of course, are the living alive cells, whereas exosome is just an envelope. They're not alive. Can they multiply? Yes, the stem cells can multiply, divide, and grow, but exosome obviously cannot. Can they become another cell? Stem cell can differentiate into different types of cells, but exosome cannot. Whereas stem cell can replace damaged cell by becoming new tissues, but the exosome can just boost healing by signaling the existing cells to repair themselves. I often describe as the difference is stem cell treatment is like putting a factory inside your body that can generate new cells, whereas exosome is like putting the message which was created by the cell so that the existing cell can work within your body. And at the end, stem cell after a few weeks being trapped in the lung or eliminated by immune system, and it could cause vascular embolism or phlebitis, whereas exosome has no risk of such adverse events. Okay, as you know, there are different sources of stem cell, and this is also a very hot topic. Often physician is wondering which source of stem cell is the best for usage, and so is the patient. So of course, in Japan, we are only allowed to do autologous stem cell therapy. The reason is because allogenic stem cell, including umbilical cord stem cell, although they're younger and therefore their differentiation function is much higher than the autologous stem cell, they have first risk of forming tumor. It cannot be eliminated. And what I found recently is that because they're allogenic, that's something not come from your own body. Once this umbilical cord derived stem cell is injected into your body, the body recognizes them as an invader, and what is called a blood-mediated inflammatory reaction start to work, which can activate the coagulation system and can lead to forming embolism in the body. So I used to believe, yes, umbilical cord is younger and probably works better, but nowadays I do believe that it is still best to use your own stem cell for the safety reason. This is also a very interesting study that we did within our laboratory, and we also outsourced to compare the result, and they both came back as a matched result, which I would like to share with you. So a lot of people use exosome without knowing the content of the exosome that they use. So we did compare and analyze each exosome that's out there, including ours, and compare the difference. I used to think the younger the source is better and has more ingredient inside, but then it turned out to be that it's not the source of the exosome that's very important. As you can see, the umbilical cord derived exosome, ND means non-detected. So there's nothing inside the exosome that was sourced from umbilical cord. Whereas our product is derived from fat tissue, but you can see that a rich source of cytokines can be found. And another interesting thing is, even though they're the same source, so company CED is same source, they're both from the adipose derived, but then depends on how you cultivate the cell, the content can be quite different. So first of all, it's not because the source is younger, it's always better. Second of all, it's really depend on the CPC quality to make the best kind of product. This is what we found so far. So another thing we do here is natural killer cells. So we have been using natural killer cells to treat end-stage cancer patients for nearly 20 years. I would say about 30% of the patients who come to us, cancer survivors, and they are living very happily and healthy. Natural killer cells, I know that you cannot use this still in United States because of probably the political reason controlled by Big Pharma. But in Japan, it's been there for quite a long time. And we're happy to use them because, again, these natural killer cells are derived from the patient own blood, and then we cultivate and increase its numbers outside of the patient body. And then once it's reach to a sufficient amount of cell numbers, we inject back to the patient body by IV. So for having our own on-site laboratory really helps us, because when I have a small clinical question that I want to make sure what is the right answer or which way I should take, then I will ask my laboratory staff to test for me. For example, once I take the fat tissue from the patient, is it better to start the cultivation right away? Or is it better to let them rest a little bit and then start the cultivation? All these small questions could be very tiny, but by getting the answer for all of these small questions can make sure that I can build up a strong base of treatment based on the evidence. So I think that can create a huge difference. Our mission is not just to make patient healthy, but happy at the same time. I noticed that the difference in a Japanese nursing home and a European or United States nursing home, that the Japanese nursing home, there are a lot of elderly people who are bedridden, and they have a lot of bed sores everywhere because they are lying down on the bed basically 24 hours. And most of them cannot even eat by themselves. That's why they are being fed by tubes, or, they have a strong restriction of what they can eat. And how they die is usually aspiration or pneumonia, because they're not really enjoying their life as they're reaching towards the end of their life. Whereas I heard that most nursing home, you cannot see these kind of people in United States or Europe. So what we're trying to do is make patients live happy and healthy at the same time. Now I'd like to share some of the clinical cases that we do here. We use stem cell therapy for osteoarthritis who has pain in their joint. And this one works quite well. I would say about 97% of the patients who receive this treatment are quite happy with the treatment because they can feel their benefits a lot. We also treat somebody who has chronic pain like rheumatoid arthritis or autoimmune diseases, or using the function of the angiogenesis. A lot of people are interested in doing this treatment for prevention of Alzheimer's or cognitive declines, or just regeneration of skin collagen and make you look younger. And this one also, I did a fat plant to the face with the stem cell so that the fat which was transplanted can last longer. So where is the future of regenerative medicine taking us? I think, as you know, there are different types of stem cells known as embryonic stem cells or iPSC or somatic stem cells. And because the iPSC and ESC cells are very strong in differentiation ability, but some issues like ethical issues or a risk of forming cancers, they're not being applied actively for clinical treatment, whereas somatic stem cell, including what we use here, the mesenchymal stem cell, do have a limitation for differentiation ability, or we cannot really design and target specific cells that we want to use for each patient. So what I'm trying to do nowadays is that direct reprogramming technology, which I partnership with Japanese university. So what is this direct reprogramming is so you take a somatic cell, okay, which cannot be differentiated to another type of cell anymore. And then you can directly make another type of cell instead of having it make to iPS cell and then convert it to target cell. So it saves a lot of time and cost and reduces a risk of forming tumor, but at the same time, you can create the target cell you want. So I think it's a great technology, and that's the future that we're going to have in, I would say, a few years. And another thing that we have newly founded in our clinic is that by using the regulatory T cells, which Professor Sakaguchi won the Nobel Prize last year for, we happen to pay attention to this cell as well. And then we actually are the first one in Japan to receive the official permission to use Treg cell to treat ALS patient. So that's also something excited in the future. So again, we know that we cannot do everything by ourselves, and I believe partnership within physician or people who understand and share the same concepts are very important to provide the best experience together. So we're always welcome for any kind of partnership, and we look forward to seeing you in Japan in our clinic. Thank you very much.
Awesome. Thank you so much, Midori Sensei. That was a really great talk that kind of walked us through the basics of stem cell and regenerative medicine. I think cleared up a lot of misconceptions that I think a lot of us have. I know that I certainly have, if I'm being honest. And then I think some of the really interesting glimpses into where the technology is going, including the direct reprogramming, which I think is super interesting. I invite people, if you're able to stay on for maybe 10 minutes or so extra, I would love to
Yeah.
answer questions. So if people have questions, please feel free to put them in the chat. I'm looking at both Zoom and LinkedIn. But while I'm waiting for others to ask questions, I'm curious to hear if you've had any experience using these Muse stem cells. I don't know if I'm sure you're familiar with those, but those are also autologous, have a little bit of a different kind of technology behind them. But I'm curious if you have a perspective on them, any experience with them, and how you would place them within where the armamentarium is going or the tool set for stem cell treatment.
Yes, I've heard about Muse stem cells, and in fact, we have been using the Muse exosomes in our clinic. And yeah, these are great. Just, works well like the other exosomes. And as you know, the Muse stem cell does last longer, and it has a stronger homing effect, as that's what is being said in the papers. And unfortunately, we are not able to use Muse stem cell at the moment because by regulation, we are not able to use allogenic. And I believe that the most of the Muse stem cell that's out there now is allogenic so far, not autologous.
And as far as the direct reprogramming technology, is that something that's available exclusively in Japan, or are there other jurisdictions or countries where that's available? Curious to hear more about that.
Yeah, so I mean, I could be wrong, but as far as I know, it's not being out there for clinical purposes only, and that's what we are going for to reach. Yes.
And in terms of like patient selection, right? How do you decide whether or not a patient is suitable? And I know you kind of talked about this at the beginning, but are there certain like inclusion, or I guess more specifically exclusion criteria that you have when you evaluate patients for these sorts of therapies?
So first of all, if somebody with an active cancer, I would certainly tell them you're not suitable for stem cell therapy because it could, turn on the switch of cancer growth. So that's definitely no. And another is because of the protocols we have for the cultivation. If somebody with active HIV positive or hepatitis, for example, then I suggest them to cure these diseases first and come back.
Yeah.
But yes, other than that, we don't really have a restriction. Just make sure that they understand the risk and the benefit enough before they start the treatment.
And how frequently, if at all, do you do kind of untargeted IV stem cells for general rejuvenation. That's something that we see people here in the West. They go to Mexico and Latin America and they get IV stem cells that are just kind of generally untargeted for rejuvenation. Is that something that you do? And if not, do you have a perspective on it?
So in my clinic, I typically do every 3 months for people who target to maintain their well health being. I think that's more than enough. If they're busy traveling, they can reduce to every 6 months or even every year, depending on their condition and the goals of their life.
And then, as part of how you treat patients, are there any other kind of adjuvant therapies that you add, like any particular hormones, peptides, supplements, anything that you kind of use to augment therapeutic response?
So I often use exosome as an adjuvant therapy for stem cell. This anti-inflammatory effect can enhance the efficacy of stem cell ability, I believe. That's why I often combine that. And I recently started to combine a lot of NK cell therapy because a lot of paper says that the natural killer cells not only eliminate the cancerous cells, but also the senescence cell, which can secrete a lot of pro-inflammatory cytokines.
Yeah, it's super interesting. I know that NK cells are a big focus here in the States too. As you mentioned, we're not looking at it through the lens of stem cells, but we're using antibodies and kind of immunotherapy to augment NK cell activity. There's a therapy called Anktiva that is in, I think, phase 2 or phase 3 trials that is being used for various cancers. But yeah, I think NK cell activity and modulating NK cells is super interesting and seems to be at the nexus of a lot of different therapeutic approaches. And so, just to kind of review, and by the way, one thing I just realized is that our LinkedIn audience is like a few minutes behind because of when I started. So they're actually still looking at the slides where you are talking about NK cell therapy. So they're actually pretty far behind. But anyway, so they may not see the opportunity to ask questions for a little bit, but we'll see if we can keep it going until then. What I was going to say was just kind of like thinking about the different indications, right? You mentioned general rejuvenation, osteoarthritis, several cases of kind of musculoskeletal health, cancer. You mentioned even ALS. I know we're going to have a separate talk about that. Are there any other kind of noteworthy indications that we should keep in mind as far as uses of this as we think about our patients who might be candidates?
Autoimmune diseases works pretty well with stem cell. Recently, I'm looking into more like a neurological problem, such as Parkinson or ALS or even, autism.
I mean, it all makes sense, right? Like to the extent that a lot of these conditions are diseases of cellular metabolism or inflammation or redox stress, and to the extent that exosomes and stem cells can reverse or address those things, it makes a lot of sense. Maybe tell us a little bit about how you work with other clinics. So, like, what does the referral process look like? What does kind of the handoff process look like for those of us who might have patients who might be good candidates? What does that experience typically look like?
So yes, so we do have a lot of partnership with other clinics around the world. And so to refer patient, we have a info email account. I think that's the first contact that can reach us. It's written in the presentation right now. And then from there, usually I would like to either talk directly to the physician and discuss before or go into directly to a patient's personal online consultation or offline consultation and decide about the treatment.
And just out of curiosity, which countries do your patients come from? If you can answer that.
We have a lot of patients coming from like Australia, Hong Kong, Singapore, because I think it's close to Japan, but we do also have patients from United States, Canada, Middle East, Europe.
No, that makes sense. And then as you think about like where this space is going in Japan and where it is right now, like how many different places are there in Japan to get this sort of therapy? And do you see there being more places that will exist in the future? Like, how do you
Mhm.
think about the growth of this field from that perspective?
As I said, I think this regenerative medicine is like a door to a new world for existing problems. So of course we need to make sure it's completely safe before we start anything, but it has a great potential. And then I think it would just increase and increase in the future.
And along those lines, in Japan, to be certified to deliver this sort of therapy, what sort of training does one need to go through to be kind of authorized to do this?
In Japan, as a physician, you mean? Unfortunately, it's sad to say, but there's no special training for this regenerative medicine. And when I started, nobody really tells me what is the right answer. So we just have to make sure that the patient understand the risk of unknown. And yeah, we just try and error. But now I have probably a certain amount of experience that I can imagine and assess and prevent risk beforehand. There is a Japanese Regenerative Medicine Association that provides a test for regenerative medicine specialists, which recently acquired. But I believe not many physicians do actually take this test. So in Japan, it's not really necessary to have this specialist license to conduct as a physician, but as a clinic or a CPC, there's a very strict regulation, and you need to file a lot of paper to conduct each treatment for each diseases.
I guess along those lines, are there like, for those of us who want to learn more about stem cells and regenerative medicine, are there any resources that you'd recommend to clinicians? If we want to learn more, are there particular like textbooks or websites or courses or anything that you would recommend?
There's one textbook for the regenerative medicine specialist, but it's written in Japanese and it might be difficult for you to read. Another one, I cannot think of my head, but I'll share in the group if I encounter some good materials to study. But like I
Perfect.
said, the history is very short and nobody really knows the correct answer. So I think we're still developing this field at the moment.
Well, I know it's Saturday morning and I don't want to keep you from enjoying the rest of your weekend. So thank you so much for coming to speak with us. The recording will be available for those of you who want to re-listen to this. And just in conclusion, if you would like to share how people can get in touch with you or your clinic, if you have any social media handles that you want people to know about, please let us know.
I think it showed our contact address at the slide. So if anybody is interested in contacting, yes, please do so.
Well, thank you everyone for attending. Thank you, Midori Sensei, for speaking to us. And I hope you have a good weekend. Thank you so much.
Thank you, Dr. Anand. Thank you, everybody. Bye-bye. Have a good
Bye.
day.
Bye-bye.